Good afternoon. So today I'm going to take you a little bit about a topic that's not so fun, not so sexy, I would say, like AI and the other topics that other colleagues, they just discussed today and share with us. My name is Khalid Adine, and I'm leading Stella Technology all the way from Dubai. Stella Technology is a Silicon Valley company that was born actually to implement health information exchange, in the US. So that's what we do, and I want to share with you a little bit more about. So I think that's, the medicine probably is one of, I would say, major success in the history of humanity, right? I think first the impact we see is that's the longevity. I mean, life expectancy is there more and more. There is, right? But however, we still have a lot of challenges. Today we hear from a lot of our colleagues in other topics and panels that we still face the same challenges. So first of all, healthcare professionals. We're never going to have enough doctors to cover, the entire population. There is really tremendous growth of population that we cannot cover it with the speed of how we are going. Rising the demand and the cost and so on. So those are really, I think, topics that we, in most of the panels, we heard some of them. That's the colleagues, they share about them. So that's where it brings that we need a kind of transformation, digital transformation, and those are a kind of, I will say, enablers, right? So we are accumulating a lot of data, and that's why we have a lot of AI, because we have as well a lot of data that we can, produce these kind of solutions and go to market. Increasing the compute as well, I think, is having hyperscalers and as well having that the machine is much more faster and all of that. It helps us, to continue improving and in building algorithms and as well computing that. There is, of course, a need to reduce the cost. So we're going to have to figure out, to always to comes up, with solutions. So I've been really amazed, to see the number of solutions of AI. I think that AI is the topic of these events. Almost that 70% of the talks was focusing on the AI and different solution, that really trying to find always like a kind of a balance between the challenges and as well finding solutions. So there is as well, patients is more empowered. They want to know more about their problems. They want to be engaged. They want to be more informed about their situation, about their health. And that's bringing us as well that we need to be really to raise the bar, right? So COVID-19 again is another one. So I just want to today talk about the interoperability. So the name itself is complex, right? I think that the Western, when they they give a name to this topic, is really complex. I promise there are really colleagues, for example, in my region in the Middle East, that they are not able to pronounce interoperability. Sometimes they just confuse that. It's complex. Why it's complex? Because I think that because the healthcare industry itself is very complex. To bring multiple solutions, multiple systems together, right? So yes, the objective is always to to orchestrate multiple solutions and multiple systems that talk each other in a good language, in a standard, and with a final objective, right? So it's to have a seamless access of the information that is optimized and as well to address bigger problems such as the population health, right? So there are multiple, layers of course of the interoperability. So you have foundational, structural, semantic, and organizational. And I truly believe that the health IT community has been working really hard. To move that, or at least to find solutions along the way, by introducing multiple standards, by bringing as well such as expertise to solve those challenges of having hundreds of systems in one hospital or health organization. So some history, right? The first IT system was in 1916, and and since 1980, there have been a big community working toward establishing standards that system in the healthcare industry can talk each other. Two things that you can see is that mainly two milestones. I will say that in the interoperability, that has been really impactful and important in the healthcare industry. One, it was in the release of 𝐂𝐸-7v2 as a standard, right? And I think that still, as of today, most of the healthcare system, they are talking this language. We talk about 1982, 89. So, it's been almost 20 years, I think, there, and still we are using the same standard. So, yes, it helps to integrate ADT systems, electronic health record, laboratory information system, radiology information system. Then, we have a couple of them, 𝐂𝐸-7v3, by supporting workflows and all of those. However, the adoption was really low, very, very low, because it brings actually more complexity than 𝐂𝐸-7v2. We had CDA release, but then FHIR appears. Okay, the sexy name of interoperability, right? So using web standards and all of that, and we start to have a little bit of, especially in the, I would say more in financial than clinical, so users. So again, there is no much trust yet. We would love, to see more and so on, but this is a history. So if you just take a look at this, honestly, there is no much progress in the interoperability. Really, we are stuck. We are really stuck, in integrating solutions. We are not yet there. Probably AI will solve, this kind of problem. But honestly, there is a huge community that is working towards solving the interoperability. A lot of engineers and and as well community. However, still is a problem. Is a problem for ministries, for healthcare providers, for organizations to bring a lot of systems. For one single hospital, probably they have more than 50 solutions. The main one, of course, is electronic medical record, laboratory, radiology, ICU, or, name it. But then, of course, we are bringing those small application, for example, for use cases, mental health, or and a lot of solutions. So how to bring all of this together? Why? The why. The why is because we need to have continuity of care, right? So you work toward interoperability to have, continuity of care, and as well to have a complete overview of what is happening to that patient, right? So, challenges. The first is the standard. Really, we are having a lot of challenges toward the standards. To integrate two solutions, just an EMR with the laboratory information system, it takes months, and it's really costly for any organizations as of today. There is, of course, missing data. Privacy and security is always an issue in the interoperability. When you try to connect two solutions, usually it's a big discussion between two organizations that they're providing solutions, and mainly in exposing the APIs or exposing, for example, the services to consumer to have that interoperability. Patient ID errors. So you identify a lot of problems in the patient ID. So I think that this is very, very common because if you don't have a real master patient index component, solid one, you really face a lot of redundancy and a lot of patients, duplications of records and so on and so on. And multiple medical records and so on. So really a lot of challenges. So as of today, these are the solutions that the industry is pouring in order to solve it, right? So first of all is to have a common standard. And the organization, they work together in order to minimize the interoperability cases and issues. So vendors, they are very proactive in building, standards quickly and adopting them. Then there is the master patient index. Yes, the MPI is, I think, is always the source of truth of any interoperability between two solutions while you are impacting the patient. And then you have the collaboration. And this is what where Stella Technology started 15 years building health information exchange in the US. And then we move right now to the emerging market, and I'm based in Dubai, and there is a lot of initiative on the health information exchange so far. So I think in Europe, they have been doing as well a lot of initiatives on having like interoperability among all the European Union countries. Still, you don't see that, like, for example, for the entire country or for the entire region. So in UAE, there is 3 health information exchange that's being implemented. In Saudi Arabia, they are doing as well a national system. In Qatar, Egypt is implementing the universal health insurance, and at the same time, they are working toward implementing health information exchange. So there is like a kind of revolution of going toward, collaboration and alliances. So this is a kind of so far a solutions for the interoperability. So this is how it looked like, a framework of interoperability. If you really want to have, I will say, connected care using, multiple solutions. So if you see, so there is like 4 processes that are, in the framework. So first is you have the sourcing, where you have all the source of the data, health information exchange, devices, sensors, clinical and operational solutions, scientific, and so on. Then you have the API layer. Then you have where you enrich and curate, the information using the normalization. This is where the standardization and transformation is happening, right? Where you do the rule management, identify management, security, and so on. And then you have the last layer, which is to organize and, of course, and analyze. And then you produce the analytics, and so on and so on. So those are, kind of framework that we need to put in practice, and in order to really to overcome the challenges of the interoperability. So I wanna, what are the benefits if we have the interoperability? In our organization. So we reduce the administrative cost, of course, given the, first of all, the manual processes that disappear. So we have, of course, solutions that are really optimized by the technology, increase the efficiency of care delivery, revenue generation as well, and reduction in the total cost of care. So those are some of the key impacts, I will say, really benefits of the interoperability, and if we really put that, this capability. As a Stella, so as I mentioned, we have been implementing a lot of HIEs in US. Today I want to talk to you about one of the largest HIEs right now in the globe. Is New York. It's called Shine. It's a HIE of HIEs. So New York is more than 20 million of population, and we had to come, to have one solution for that for the entire state. As I mentioned, in US, you have multiple type of HIEs. You have HIEs that are regional, and you have HIEs that are in states, right? So our role was actually to build and design the entire interoperability for all of these HIEs. There were 6 HIEs. So that's, for every single region. And the team has put a tremendous effort actually to, first of all, to come up, with a standard to connect all of the HIEs. Implementing that by bringing solutions such as, InterSystem, ABM, name it. There were plenty of electronic medical records in the entire region for all the hospital and all of that. And, the complexity, the first complexity was to find a solution to come up, with one master patient index, how to identify the patient, So this is what, so we designed that based in IT profiles. The solution was comprised of course, of a statewide master patient index. And then, we have done an orchestration using queries to, to really identify the patient record from every single, instance. So this is why, I just want to highlight about the role of the interoperability in the healthcare. So if we are looking on continuity of care and integrated care, without interoperability, we're never going to achieve that, no matter AI solution we have or wherever. So that's the baseline. That's the key. That's really the baseline, to achieve integrated care. So yeah, that's pretty one of the initiatives that we are doing right now. Is there are in United Arab Emirates treat HIEs, Nabid, Riayati, and Malafi are national-wide, electronic medical record under Health Information Exchange. So we build a platform that is to address the small business and practice managements that they are integrated to the Health Information Exchange, but on the same time they have a tool, to address, for example, the daily need and operation in the healthcare practice management. So, yeah, that's pretty much. I take his time is over. So if someone would like, to learn a little bit more what we do, and as well, to have a chat, so I'll be happy, to discuss further. Thank you so much.